Okay, great. So welcome everyone. Thank you for joining us today. Last week I had my first Facebook Live event and it was great to get so much feedback from folks. So I'm back again. We're going to do a series each Friday at 4:30. You can find me here at Facebook Live. And I hope that this is a good way to engage and stay in touch with folks. So welcome. Just for an introduction to folks who don't know me and my campaign, I'm Lydia Crafts. I'm running for House District 90 in the Maine State Legislature. We have a primary that's been moved from June 9th now to July 14th. And so during this pandemic, we're finding new and innovative ways to reach voters. And here we are. So I'd like to first start by thanking Hannah Harder-Ives, who, as many of you may have seen, wrote a letter to the editor in support of my campaign, which I'm deeply grateful for. Hannah and I first met when I began volunteering at New Hope for Women. And because of her letter this week, I thought it was a great opportunity to use time today to talk about safety, domestic violence, and then a little bit about child abuse. It's work that I'm familiar with. It's work that I'm aware of and stay connected with now as I am a school counselor. So I've invited Kelly O'Connor to join us. So welcome, Kelly. Thanks for being here.
Thank you very much for having me, Lydia. I'm happy to be here.
Great. So Kelly is the Director of Education and Outreach. Is that right, Kelly?
Yep, absolutely.
Excellent. Can you tell us a little bit about your work at New Hope?
Sure. So I've been working at New Hope for just over 3 years. Moved to Maine in December of 2016 and started working shortly thereafter. I've been in my current position as the Education Outreach Director since for 2 years now. So what that looks like is I essentially oversee our prevention programming. So a lot of our work that we do is not just direct service, but a lot of technical assistance and training and violence prevention work with youth and law enforcement, as well as mental health professionals. A lot of that right now is on hold as we have focused more on our direct service currently. But I oversee that. So there's 6 folks that report to me, our youth educators, our community prevention educators, and our DVCPS advocate as well.
Great. So can you start just by giving us an update on what's changed at New Hope for Women with COVID-19 and this pandemic? What do services look like now compared to a month or two ago?
Yeah, it's a really important question. So first, I want individuals to know that we are still here and we are essentially fully operational from a direct service perspective. Um, we had to make the difficult decision to go to remote-based work in middle to late March, third week of March, I believe. And so all of our staff are still staffed, but have been working from home during that time. So we have paused all of our prevention education work, all of our work in the schools, any technical assistance and training that we had scheduled in line with the current CDC and public health recommendations for social distancing. And we have had to reevaluate how we continue to provide services. One thing that people should know is that we were really well positioned to go to remote-based work, given the phone, the helpline, that's really the bread and butter of domestic violence agency work. Our helpline is where this all really kind of began many decades ago. So we have our 24-hour helpline. It's staffed all day. And so we're continuing to be able to provide, do safety planning and talk with folks about what their needs might be and connect individuals with community resources like we always do with our helpline. We just can't meet with folks in person right now.
Okay, so there's no live in-person meeting.
Correct, which is a shift. We typically had drop-in hours, open drop-in hours for victim survivors to come at our Rockland office at any time. That work is not happening right now, but we can talk with people on the phone. Our one big change too is the court work. So we have community-based community and legal advocates that one for each county that we serve. So Susanna is our community and legal advocate for Lincoln County, serves the Wiscasset office, or court, I should say. And So we're able to help individuals navigate the civil legal system via the phone right now. And what I mean by that mostly is protection from abuse orders. So through that process. So we're staying up to date on any of the changes that are coming through the courts. I'm happy to talk about some of the changes that have happened related to people being able to obtain PFAs, protection from abuse orders. They can still do that. There are some added barriers that we are helping people navigate, but the courts are still open and are still receiving filings for the PFAs.
That's really important for folks to know about that. While we hear like courts are shut down, they're closed, not for PFAs.
No, they're not closed for PFAs. And so unfortunately, we can't have our community legal advocate accompany anybody to the court when they go through that process, but we're there to talk with them and prep them before they do that, afterwards, and continue to safety plan depending on what the outcomes might be of those court proceedings.
That's great. And then tell me about the chat service. I know this is new and exciting, both in our district, but also I think it's been uncommon. It's a new way to serve victim survivors.
Yeah, that was one of the things that we looked at right away when we started. We realized that this pandemic, we didn't know, we still don't know how long this is going to last. And I think we thought, okay, we need to get creative. We need to be nimble and responsive to these unprecedented times, at least in contemporary history, and think about how we can reach individuals who might be at higher risk as a result of the social distancing and the stay-at-home order. And so we worked with our team and identified a chat service, an online chat service. So right now we have a live chat service available for victim survivors and for concerned others, but primarily for victim survivors who need to utilize that resource 1 to 5, Monday through Friday. And people can access that chat service by going to our website, which is www.newhopeforwomen.org. And just click the start chat button. So 1 to 5, we'll get to chat with a live advocate.
And so let's talk a little bit about sort of the pandemic and what that's like now in the world of DV, because, you know, Governor Mills issued her stay healthy at home order. And for a lot of us, it's a privilege to be able to stay home. And whether that's continuing to receive our pay and work from home, or for some folks who are on unemployment, it's changed their status. But the reality is that it's not always safe and good at home for adults and children. And so I imagine, and I know there have been a lot of headlines coming up around the pandemic, and also releasing incarcerated folks, and how do we ensure that folks can be safe, and what happens if they're not? So can you talk a little bit about domestic violence right now in COVID-19?
Yeah, it's been fascinating to see how this topic, this issue has just been amplified globally. Encouraging and also scary, because that is the reality. So the first thing I'll say is that stress doesn't create domestic violence. Relationships that were healthy and fair and balanced and respectful prior to COVID-19 are not all of a sudden going to become imbalanced where there's coercive control at play. There might be additional stressors in those healthy relationships, and what that looks like might be challenging, but we're not going to see new instances or new relationships where DV is at the primary core of that relationship. What we are probably going to see is a potential for increased risk for victim survivors who were already in a relationship where power and control was at play.
I feel like increase in that risk where, you know, some of that control or power imbalance looked one way prior to the pandemic now may escalate with new circumstances and stressors.
Yes, I think that's a fair characterization. I think essentially as I expect an increase in risk for an escalation in violence or control in these relationships, because a lot of the social safety nets that have historically been available to victim survivors are not there right now or are limited. So I think about school, for example, for kids to be able to go to school. Now kids might be trying to do their online schooling at home where it's not safe. Additionally, employment. Victim survivors may have had opportunities to continue to stay even when they were employed, to get a reprieve or to get some space. And so it's interesting too. DV survivors have a lot to teach the world about how to navigate social isolation, actually. Abusers, this isn't really new to a lot of victim survivors. It looks different right now, but we know that abusers, one of their key and most devastating tactics that they often employ is to isolate their target, their victim survivor, from their community, whether that's friends and family or their employment, their school. And so I do believe that victim survivors have, sadly, a wealth of knowledge on how to navigate this situation right now. But we need to support them to stay as safe as possible during this time. And I'm happy to talk a little bit about that and how people can help them do that.
Yeah, I think that's a great message. And I also see what you're saying around employment or those kind of forced interactions that someone who is controlling their social relationships, those work relationships or opportunities, just being out in the community may be the only social interactions or sense of relationship that some folks get to establish and maintain safely. And so I can imagine that the loss of that can feel like an added grieving, an additional loss to what they possibly have already lost while being in an abusive relationship.
Absolutely.
Yeah.
And I think that we've also seen, unfortunately, and have heard from victim survivors we've been working with, abusers targeting their health. For example, restricting them from obtaining health care if they need it. We know that that exists before COVID, but that is an added risk, or intentionally trying to expose them to the virus. That's something that is a concern of ours, and of people that we've talked with. So that's an added layer that didn't exist before, or looked different, I should say. Um, so I think one of the key messages that we want people to take away is that it's vital anyways, pre-COVID and post-COVID, for people to stay connected with people they're concerned, their loved ones they're concerned about. The power of just a check-in. How's it going? How are you? How can I support you? I've done more, my own family, who's scattered all around the country, has done Zoom calls, more than the first time we've ever done them. So if it's safe to do so, right, to check in and say, hey, how can we stay connected? Maybe they are able to go on a safe walk together. Maybe they are able to say, hey, maybe I could reach out to New Hope for Women for you. And just ask how best to get this information to you, because maybe it's not safe for you to reach out directly. Things like that. But we urge people to stay connected with everyone during this time, but especially those victim survivors in their lives that they are concerned about.
And maybe also know not to take it personally if someone's not able to reciprocate that connection, that it may be a safety issue more so than a reflection of your friendship with that person.
Honestly, our entire work is through the lens of safety. And we always make the assumption that people are making the best choices they know how to make to keep themselves and their children as safe as possible.
Yeah, that's great.
So certainly not to take it personally.
It's so important. It's good. You've just mentioned a bunch of great reminders for all of us, whether we're familiar or not with the resources. Can you talk a little bit about how folks can support New Hope's work right now? I know I've had a lot of voters, constituents, folks who want to help out, but also don't feel safe for clear reasons, leaving their homes for health reasons. So what would be of the greatest benefit to New Hope right now?
We've been looking at our service provision and what this looks like, and how we have adapted some things. So beyond the chat service, which right now is actually free to us through the company that we've been using for our database management system, which has been wonderful. So how the private sector is kind of stepping up to help out nonprofits. One thing that we have made adjustments to is our sheltering model. So we have been able to partner with a handful of local motel hotels that are stepping up to provide longer term shelter options for victim survivors right now. I won't, identify those partners at this time due to safety concerns, but it's been incredible to see people step up. That's made us have to look at our financial resources on how we best support victim survivors more for longer stays in hotels. And so I know we are applying for some grants around to support those efforts. But if people are able to donate financially to help us respond in that way, that would be incredible. We recognize that not everybody is in that position and would make no assumptions that people would be able to do that. But if people are interested and want to be able to help out this marginalized and at-risk population right now in this way, please contact us. I can give you all, obviously, our contact information, Lydia, which you have. On how
Yeah,
to
and I think there's a direct donate button online at newhopeforwomen.org too.
yes. And if there are any challenges with that, Joan Lamole is our development director. And so people can email her directly, and I can give you that information. Maybe you can include in the messaging at the end of it.
Sure. Yes. Yeah, I can add that to the comments and also the helpline. Just a side note, I've heard reference to helpline versus hotline. Is that a language change?
Yeah, it is. It's something that we've been working on at the statewide level for the last couple of years, mostly because we want people to know that you don't just have to be in crisis to call the helpline. This helpline is available for concerned others. It is available for professionals, mental health providers or medical providers or law enforcement in the community that have some concerns about a client or patient that they are working with. And so it's just it's a better term that kind of we hope emphasizes that anyone can give us a call, not just somebody who's in crisis.
That's great. I like that. It makes a lot of sense.
Yeah.
So, Kelly, I'm going to pause and just quickly jump over to our Facebook platform to see questions. So a sense of whether victim survivors are able to access mental health services during this time. Are you hearing from folks that who are have previously received mental health services? I know that sometimes can be a good professional support that people use. Telemedicine services. Are you hearing from people about continuing to receive services?
I can't say that I have personally. I would imagine that maybe some of the other advocates that have been managing the helpline may have talked with people about that. We do have a list of therapists and mental health providers in the area that we, will provide to individuals that are looking to seeking support, mental health support, that we provide to them for them to do their own process. So I don't know what the individual practitioners are doing right now.
Yeah, and I can probably speak a little bit to that. I know myself, I am providing services via telemedicine, and I think it's pretty common right now. I think insurance companies have made exceptions. Folks are able to connect pretty well and smoothly. I know there was a week or so back in March where I think people were struggling to get established, and it was a steep learning curve, but it does seem like accessing mental health services continues to be readily available for folks who are looking. I know Lincoln Health is providing it. Some other providers here in Damascus and Newcastle have gone, and the schools are also continuing to use telehealth. So it sounds like everyone's kind of moving to the digital realm, which I mean, I know we're sort of starting to wrap up, but I would say that must simultaneously still create barriers. It does mean that you have to have phone access. It does mean internet access. And I'm big on plugging broadband expansion because I think receiving services, education, medical services, community supports like New Hope's chat line requires internet access. And the public libraries aren't open, or the other places, schools or community centers aren't available right now. So that's a challenge.
It's clear that access to the internet and broadband is not a privilege. It's a basic need at this point, and has been probably for a while. But the way that we navigate the world, the internet has become a vital part of the way we navigate.
Yeah, so I would just also plug, not only do I have a primary on July 14th, but there's a bond issue coming out for a $15 million internet expansion bond through the state. So I hope folks are able to get out and support that too, because I think just like you're saying, Kelly, it's, some people reference internet as like gaming or simply social networking. And I think we see, especially at times like this, that it has filled a critical, vital place in our communities. And uh, that for folks who are in marginalized communities, it gives leverage or access to things that they may not otherwise have access to. So appreciate that. Let's see. Good. So I guess at a state level, I would also talk, I started volunteering at New Hope, just to give folks a little bit of a background, back in 2009, I think, and worked as the domestic violence liaison at the Department of Health and Human Services. And so we see, someone asked, sorry, Kelly, I should step back. Someone asked about priorities in Augusta, sort of at the state level for domestic violence resource centers. And I think, Kelly, as you've illustrated, they play a vitally important role in the health of our communities, and that they're important for both survivor victims and also for their families and their social networks who are concerned or worried about the adult safety, the children in the home safety. I know those two things can be challenging to manage, especially with DHHS involvement. So I think that continuing to fund DVRCs is really important. I'm not sure if there are changes in funding models, but I know there has been conversation around services and what those look like across the state. For clinical staff, we've just completed our required CORE training, which was phenomenal for me to participate in. So this is a statewide initiative where all clinical therapists, psychologists are receiving a core 2-day training in domestic violence treatment, or not treatment, excuse me, just in domestic violence theory and community services. And I've heard from other therapists that it was an incredible opportunity and that we all learned so much about the importance of the work, because it really is, it's not a service that pathologizes. It's really a clear foundational service that all communities need for folks, because domestic violence is pervasive and it doesn't know, there are no limits, right? We don't see it occurring in certain socioeconomic pockets. It's not divided by demographics. So it's everywhere. And like you said, Kelly, it really comes down to that imbalance of power and that assertion of control over an intimate partner. And until that has changed, all of our communities will continue to need that service. To get back to the question, I would just be a huge proponent of legislation that supports continuing to fund and expand, Kelly, your work in education. I think we have one of your educators, Lisa, comes to our school down at Bristol Consolidated and works with kids all the way through middle school, and talking about developing and building healthy relationships and what those look like and how we all get our needs met when we can establish and maintain those relationships. It's a long range goal. And I think that New Hope for Women is really doing that at all levels. Like you said, it's not just about direct services in the helpline. It's really about reaching every person in our community, because as we address those imbalances of power in relationships, then we see our entire community succeed more. And I really, it's been powerful. I mean, I think New Hope for Women started around 1970.
81, yeah, 81. So we're going to have our 40th anniversary in 2021.
Oh, very good. Okay, so 40 years, right? I mean, over the course of history, that's not a long time, and so I think the work that you're doing is incredible, and so
I would just highlight that. I mean, we need to have a paradigm shift in the way that we view domestic violence, and it should be through a lens of public health. It is a public health issue. and it needs to be treated as such. And it, as you mentioned, it is pervasive. Um, and I'm so happy that the legislative changes came through where licensed clinical social workers and other mental health professionals are required to get those 12 hours of training in domestic violence. I'm one of the trainers of that content. We work, and we've got a great team that trains individuals on that material. And it's because it's that pervasive, right? It's in our mental health community, it's with our medical community, it's with law enforcement, it's with our schools. It's that kind of coordinated community response model that we need to continue to bolster and educate and train to have a really effective response to supporting victim survivors, but also holding abusers accountable. And that is this other piece, right? This prevention piece. How can we stop this from happening in the future? And so our youth focused model really tries to dig into that, and is something that is energizing to me, and obviously on hold at this time as schools are just getting by as they support their kiddos right now, but an area that I'm very passionate about, the prevention piece. How can we stop this from happening in the future?
Yeah. Oh, great. Well, Kelly, I really appreciate you joining us today. Thank you so much for being available. I will post information about New Hope for Women's Services below in the comments. And if there's anything else, please feel free to follow up on this or in a separate post. I don't want to miss out on anything. So
one thing I just wanted to mention, sorry, real quick, is that if people are calling our helpline, which it's 1-800-522-3304, we have been experiencing an increase in ring time. So it's been taking a little bit of time for the answering service that we use to sometimes answer the call, not all the time. But I just want to let folks know that if it's ringing, somebody will answer. Just hang with us. That answering service is seeing an increase in call volume, as many other businesses are starting to use this. And we're very grateful for the work that they're doing to support us right now. So just wanted folks to know that if it rings for a little while, maybe 30, 40 seconds, somebody will answer. So just hang with us, and we will get back to you as soon as we can.
excellent. Wonderful. Well, thanks so much, Kelly. I really appreciate it. And stay well and be healthy.
You as well.
All right. Take care.
Bye.
So let me just quickly check comments and make sure I'm getting to everything. Excellent. So I wanted to transition a little bit from domestic violence, which I'm greatly appreciative of Kelly joining us today. And I wanted to talk about child abuse and child abuse prevention. So I work in the schools. I'm a clinical social worker down at the Bristol Consolidated School, and the DOE, Pender Macon, our DOE Commissioner, Department of Education, put out a great visual announcement to folks about child abuse and how we can ensure that we're doing our best to keep children safe. And if for children who are not safe in their homes, that we're making sure that those families get support and referred to DHHS. So a couple of things to talk about. Sometimes, so my work at New Hope was this liaison between DHS and New Hope for Women. So one of the things that often happens is in a family where one of the partners is abusive, children are exposed to that abuse, sometimes suffer abuse directly themselves. And that family may be then referred by a mandated reporter to DHHS and their Office of Child and Family Services. So when that happens, historically, there have been some barriers to the adult victim getting support and help in their role as a victim survivor in that relationship. And so my role there, and it continues now, was to really help bridge that gap, to make sure that parents of children who were in abusive relationships could get advocacy services and help in advocating for their own families and their children, while also being accountable for their children's safety. So we had 2 horrific deaths of young children in recent years in the Mid-Coast Maine area. And as a result, I think a lot of our community is very aware of and pays high regard to DHS, the work of child abuse prevention, and making sure that we're all educated and aware of how our roles as professionals can be to help children seek safety. So this happens frequently at school, right? Classroom teachers, staff at school, pediatricians at hospitals or doctors' offices, their daycare providers, they're coming into frequent contact with children. And so at first signs of risk or potential mistreatment or abuse, we as mandated reporters make an immediate call to DHHS and they investigate. So what's happened now, what's changed is all of these adults who were at one point heavily involved in the day-to-day lives of children as a whole have been removed. And so school has become remote. So we are seeing children only by video screen and fairly infrequently comparatively to before the pandemic. And so we don't have the assurances, we don't have the visibility of children in a physical sense to ensure their safety and to know if there are behavior changes or signs of something happening. And why is that? There are a lot of theories about child abuse and suppositions that child abuse is and will increase during this pandemic. I think that there are probably a few factors that contribute to that. One being a change in routine, just like I said, that change in schedule and access to other adults makes it really difficult. We're also at home with our children all the time. So while parents may have been accustomed to sort of a break of time with their children when they went to school or when the adults were out of the home for work or other reasons, that's ended with self-quarantining. And that can be really hard. It can be hard for all of us. It can also be hard for adults trying to parent and possibly feeling challenged with new behaviors, children reacting to the change in routine. It's common to see a behavior change, and there's a lot of uncertainty, right? There's uncertainty in adults in their lives, and that translates to uncertainty for children. So it's really common to see behavior change, and that can be hard to manage without skills, without supports that adults typically have used. The other thing is loss of employment. So financial strain and stress is certainly a factor in creating tension and stress in homes, I think across the state, across the country right now, and being aware of the financial hardships that kind of infiltrate how our sorry, a woodpecker just showed up on my window. How financial stress really contributes to our own ability to manage our own home stress at the time. And I think that that's important. I just read 101,000 unemployment claims in the state of Maine as of this week, 26 million across the country. So loss of work and increased financial strain is huge and should not go unnoticed. We also know that the safety net that people could rely on, so extended family, that isolation that's been created doesn't give families an opportunity to take a break from or have space, just like a loss of routine with school or daycare has changed our routine. The loss of relationships of folks who can step in has caused a shift also. So we see a lot of these factors coming into play for children and families across the country. And there are a couple of things that we can all do, I think, to increase safety for children in our own families, in our neighborhoods, and in our communities. So one of the things to know is it's really important to stay engaged. So people families who may or may not have been struggling before this, we are we're disconnected physically, but it does not take away our need for human connection. And so we can all take a role and play a part in staying engaged and connected with children and families. So this may be with neighbors, it may be with your own extended family. It may be if you're part of a community network, either a religious group or some other affiliation that you have, making sure that folks are reaching out to everyone, that there's a way to at least verbally check in, but hopefully also through video chat to physically assess and to be aware of signs or symptoms of mistreatment or increased agitation or stress in the home. I think that we see parents doing the best that they can every day, and um, there's a lot of judgment and criticism of parents when there is child mistreatment. And while I value accountability and keeping children safe, I also think that safety increases when parents feel connected and supported. And so reaching out to families and making sure they have what they need. Healthy Linking I'm sorry, I always get them confused. Healthy Kids in Damariscotta is our child abuse prevention organization here in Lincoln County. They're continuing to provide resources to families. They can offer parenting support. I will include their phone number and website in comments. So please know that there are services that continue to be available, and also the child abuse hotline. So the state has a 24-hour abuse reporting hotline. And even if you have a question or a concern and you're not sure, you're welcome to call and talk to someone. It's staffed 24 hours a day. And so there's always someone available. And if they're not, they can call you back to answer questions or take a report if you have significant concerns. So I just wanted to talk about those resources. Healthy Kids is huge in our area. Also school counselors, local clinical therapists, people who are trying our best to stay connected, but may not have the capacity to see every child, and families who, like I said earlier, may not have the ability to, utilize the internet or may not have phone service. And so finding creative ways to check in on neighbors. I think our community has really stepped up in the last month, and we see people really reaching out and wanting to support our neighbors and our friends and our families. And so stay engaged, no signs of abuse or neglect. So what's someone saying, right? Is a child trying to tell you, or an adult trying to tell you that they're struggling? Take those things seriously and validate them, and make sure that folks are getting the support that they need, either from Healthy Kids, from New Hope for Women. There are statewide helplines and hotlines for child abuse. I will include those again. And really, I think it's so much about staying connected to people around us, and to ensure that we all have a safe home to be in. I really appreciated hearing Kelly talk about their transition to sheltering people in local hotels and inns. I think that's a really creative and awesome way to see our own town stepping up to help out. So let's just see. I want to make sure I get to questions. Oh yeah, so online helplines for parents locally. So statewide I also know that Healthy Kids is available. I will put those in the comments. I see Kelly has put a few things in there. And reach out to your schools. If you're not sure, if you are worried, but you don't have evidence, or you're just not comfortable or don't understand the process, that's okay. Reach out to your schools, because every school has a school counselor or a school social worker or someone who can be in touch with you and who they themselves can reach out to families and connect with. I know it's April vacation right now. And our school has taken a break from remote learning. So we'll all be eager to reach back out to families next week and to get in touch. So there's always someone available at schools, or someone to connect with if you're concerned about someone yourself. So that is everything I wanted to chat about today. I really appreciate everyone joining us. A couple of things. I've been sending out biweekly newsletters, so please be sure to join in if you have not yet. You can go to lydiacrafts.com. There's a link to join the newsletter. Also, I really want to plug absentee voting before we wrap up. So the primary election has moved to July 14th. And one of the safest, most reliable ways for you to know that your voice will count this primary season is to request an absentee ballot. There's a link directly at my website. You can go to maine.gov and get connected there also. But lydiacrafts.com will take you to a link and you can register. Ballots will be sent out starting at the end of May. So we're looking at just a month ahead. And I'm really excited. We'll continue these Facebook Live series. We'll do a theme each week. So check back in next Friday at 4:30. I'll be really excited to be back, and be well, stay healthy, and stay connected. Please be sure to follow my Facebook page, and we'll be in touch soon. Take care. Bye.